with knee injuries is they are not yet comprehensively, as in totally very well understood. Now, what is this center of excellence? What is comprehensive care? It is not just about having an injury, saying this is the injury, you require surgery. No. If it is just this is the injury, this is surgery, the result or success rate will be something like 60%, maybe maximum 70%. It is about telling the person, no, you don't require surgery. You can get better with surgery. So the surgeon should be as enthusiastic in offering treatment which is not surgical. Every patient for every injury does not require the same treatment. Everybody, we are not computers. There are people who require, and sports people will come and tell you here how they had ligament surgeries and reconstruction and how they get back to sport. At the same time, if a 55-year-old office-going executive gets a ligament injury, we can very well manage with exercise alone. And that is the whole reason we have a dedicated team to say who requires what and what is best for whom. Now, there are many misconceptions among people. People get scared of having surgery. It is not about surgery being high risk. It is just a thought block sometimes. It is a cultural block. Therefore, if we do surgery, it has to be such that somebody can be up and on their feet within the same day. Now you can see the reports we have published here. It is not about me standing up and saying marketing that most patients will stand up and get up on the same day. These results have to be documented by somebody who doesn't have bias. And these results haven't been taken by us doctors. It is from the hospital records, from the nursing records, that if you see in the last 4 years, if all patients who have had surgery have stood up, walked and done stairs, automatically there has to be the success. Tomorrow, if your brother wants surgery, it'll come to everybody's mind. What is my chance of success, doctor? Why should I have surgery? What is the risk? And if I see 100% patients have got up and walked in the last 4 years, what is the chance that your brother is going to get up and walk? 100% only, no? So therefore, having that consistency, the same success rate documented requires a proper approach as to what surgery is required for whom. Now, what goes wrong many times? Many times what goes wrong in our setup is, in India, 90 to 95% of hospital facilities are not focused and specialist. Now, I will tell you, a state-of-the-art center like we have for knee and hip would be there in just about 4 or 5 places in India. Whereas these things are generally treated by orthopedic surgeons. Now, orthopedic surgery is so vast that treatment principle for fracture is very different from treatment of ligament injury. Anybody who calls themselves arthroscopist may not be the whole and sole person to treat things properly, because 50 to 80% of injuries can be managed properly without surgery. Now, when it comes to surgery, it has to be planned properly. You can't just decide today and do the surgery tomorrow. It has to be, certain exercises have to be given, the safety has to be checked, only then it has to be scheduled. And when it is done, the recovery should follow, the physiotherapy should follow after that. Otherwise, a well-done surgery can get failed. Similarly, there are many misconceptions among people. When we tell them, okay, you've got an injury, you need an MRI, everybody goes. Nowadays, patients themselves will go directly have an MRI. How many MRIs would be there in Mangalore? About 40 at least. But how many of them give sometimes wrong impressions? So many times we get reports on MRI saying cartilage tear. I get one consultation every day saying, okay, my MRI has shown a cartilage tear. What do I do? Doctors many times read the reports and say, okay, cartilage tear, you need surgery. You will be surprised if I tell you 50% of those cartilage tears, we say go walking home, you don't need anything. You need to examine the patient properly. You need to give them the right exercises and do surgery only if required. That is why it has to be comprehensive. So if surgery is indicated, it should be done for what is required. There are so many MRIs out there which are done, but the right problem is not detected. Now, cartilage injuries. In knees, cartilage injuries will be there in 3/4 of the injuries. Cartilage injury means surface cartilage. It is different from ligament, and there are different types of cartilages. One type of cartilage is meniscus, but the other type of cartilage is surface cartilage. Now 90% of MRIs in India, and definitely that statistics applies to Mangalore as well, do not have the mechanism to detect this surface cartilage injury. The development of a comprehensive center therefore includes liaising with the right technique of imaging, that is correct MRI. If an MRI is done, it should be the right quality so that no part of the injury gets misdiagnosed. So if the person has a cartilage injury and the MRI sometimes sees a meniscal tear, the person ends up having wrong surgery and therefore it is not successful. The cartilage surgery and cartilage repair can sometimes be done by just injections. We have different types of injections like stem cell injections, which again are not scientifically done many times. So having the right awareness, seeing what applies in the right place is eventually to the doctor, his expertise and the whole team with the right amount of facility. It is not one person but the whole team which contributes to the success. So what we will then, if we do surgery, recovery is important. Assessment in terms of how a person walks, whether his dynamics of gait, exercise, what we call kinematics is right, is important. So that from A to Z, covering it all under one umbrella makes it comprehensive. We will try and elaborate a little bit by people who have had these injuries and have had been treated, giving their own accounts of it. I'll pass it on to Hari.
Thank you so much, sir.